Daniel the science guy. Daniel the science guy.
Today on Daniel the Science Guy, we're going to be talking about drug metabolism. What up?
When a person takes a drug, it goes through the four following steps: absorption, distribution, metabolism, and excretion. Those four processes make up pharmacokinetics.
Drug metabolism is defined as how the body chemically changes a drug, usually in the intestines or liver. It involves breaking down a drug or adding a chemical that makes it easier to pass into the urine or stool.
Drugs are metabolized in the body by a group of enzymes known as the P450 system. These enzymes are found mostly in the liver and intestines. Now over to my lovely assistant Ashley to talk more about the P450 enzyme system.
Thanks, Daniel. As he was saying, these enzymes have the ability to take active drug compounds and make them inactive. Or they can take an inactive compound and make it active, otherwise known as a prodrug. In addition, they can take safe compounds and transform them into a toxic form. These enzymes also have the ability to increase or decrease the desired effect of a drug and break down compounds into parts that are more easily excreted by the kidneys. Back to you, Dr. Daniel.
Thanks, Ashley. When a nurse is about to administer a drug to a patient, they must take several factors into consideration in regards to metabolism. Depending on age, drug metabolism may be increased or decreased, affecting toxicity and dosage. The patient's nutritional status must be taken into consideration, as well as drug interference. When one drug interferes with the metabolism of another drug, drug levels heighten, which is called inhibition. On the other hand, a drug can speed up the metabolism of another drug and cause lower drug levels called induction. Now over to my lovely assistant, Kelly.
Thanks, Dr. Daniel. It is crucial that nurses understand the significance of drug metabolism factors so patient safety can be ensured. If at all possible, we must avoid adverse effects, negative drug interactions, and organ damage. Patient safety is our first priority. Dr. Daniel, can you wrap up this week's episode?
To sum up this week's episode of Daniel the Science Guy, nurses should be knowledgeable of drug metabolism so we can provide maximum benefits with minimal harm. See you next week!
Daniel the science guy. Daniel.
Stop! Don't pay attention to him! Stop!
Come on, that's what was that perfect one.
I know. I know, but I was watching you and I didn't even do the deep voice.
Alright, go again. Can you erase that one? Yeah or no?
Yeah.
Okay.